everybody, and welcome back to Mondays with me, Dr. Crystal. Today, I'm going to share with you guys some of the questions that I get from my family and friends on the daily. I've been keeping track of them over the last few months in this little book called Notes, in case I forget what's in it, which is notes. And I know what you're saying. I could have just kept them like in a note in my phone, but I am old school, and so I like my book. So leave me alone. So I want to start off by saying, and this goes out to my family and friends too, if you have a medical concern, it's always best to go see a doctor in person so that they can examine you, make a good diagnosis, and treat you appropriately. I really don't mind when my friends ask me medical questions because usually I can try to point them in the right direction. But if there is any concern at all, I definitely want them to be seen and not just have me answering something over the phone. Anyways, let's see what's in this book. All right, first question. What is a cabbage? A cabbage is a delicious leafy green that pairs really well with corned beef. Okay, I'm sorry, that wasn't funny. To preface this question, this person had been binge watching Grey's Anatomy and they had been saying it a lot, and so that's why they were wondering what this means. In medicine, we use a ton of abbreviations, especially when we're documenting or talking to each other. We really try not to do this in front of patients because we want you to understand what we're saying to you, but sometimes these things slip, and obviously in a medical drama, they're trying to make it realistic, so they're just throwing out these abbreviations and not really explaining what they mean. So Cabbage, C-A-B-G, stands for coronary artery bypass graft. Sometimes if someone has blockages in the arteries of their heart, the doctors will be able to put a stent in there to kind of hold it open and make sure the blood's able to pass through. But sometimes if they're not able to do that for whatever reason, or there's multiple places where the arteries are blocked, they need to use a different vessel to bypass the vessel that's damaged. So what they'll do is take a vessel from somewhere else in your body, oftentimes it's the leg, and put it in your heart to bypass the vessel that's blocked. So this is a big open heart surgery, but luckily there are surgeons who are really good at it. Next one, confession. I just took a break to go get a snack and eat a hard-boiled egg because I was starting to get hangry and I didn't want to subject you guys to that, so you're welcome. All right, next question. What is this skin lesion? Accompanied by a picture. So I get these literally all the time, and they are my least favorite because I never know what it is that someone's sending me. Dermatology is difficult as it is, but when you're sending me a picture and I can't actually see it and I can't touch it, it makes it all the more difficult. I need to feel it to see if it's scaly or warm, or if it's dry or raised, and from a picture, it's really hard to see all that stuff. So what did I say about this skin lesion? I said, well, it's small, it doesn't look like an infection, there's no surrounding redness, it doesn't look like it's draining or anything. She told me it wasn't warm. It kind of looked like ringworm, but usually ringworm has a little central clearing in the middle, and it didn't have that. She had told me they already tried cortisone, which is an over-the-counter steroid, and said it wasn't really getting any better, it was actually getting a little bit worse. So essentially, it looks like it might be a little fungal infection. I told her to try an over-the-counter antifungal for a few days, and if it gets worse or it's not getting better, then she needs to see a doctor. And honestly, I never heard from them, so I don't really know what happened or if it got better or not. So I guess I said at the beginning that I didn't think it was infection, but I meant a bacterial infection that needs antibiotics. It looked like a fungal infection that needs antifungals. Anyways, next question. Do you know someone who will prescribe me blank? What the heck? No, I don't know someone who will just prescribe you blank. First of all, you're not giving me any more information than just that you want to have this medicine. Second of all, I don't know what that other provider is going to decide when they see you. I don't make decisions for other people, and I don't want other people to make decisions for me. When somebody comes in to see me, I'm hoping that they trust me enough to let me use my knowledge to make my best judgment to treat them how I think they should be treated. And so I don't want to put words in anyone else's mouth or make any promises that someone is going to treat someone else a certain way, because they might not want to do the same thing that I might do. It's called the art of medicine, people. Beautiful. But really, if you think you need a prescription for something, you should probably just make an appointment and get to the doctor. doctors. Don't ask me, please. The next question in here that I have came when we were watching an NFL game. So it was a sports medicine question, so I was excited to answer it. They were talking about injuries of I think it was one of the quarterbacks, and my friend asked me, is a labral tear the same as a rotator cuff tear? And I was like, no, child, come with me. Let Dr. Crystal drop some knowledge on you. So I'm sure at some point down the road we'll go in more detail into shoulders in a different video, but essentially the shoulder is a ball and socket joint. It's kind of like a golf ball on a golf tee, and so that tee is really shallow. So in that socket and sticking out from the edges of that socket is the labrum, which is an extra piece of soft tissue that helps keep that humeral head in place so it doesn't pop out. Now the rotator cuff is a group of 4 muscles that come around the top of the humerus and attach on essentially to hold it down in that socket so it doesn't pop up. So 2 completely different things. We could talk for hours about them and I would be happy to, but I don't think you guys want to watch this video for hours, so we'll talk about it at a different time. Alright, so this is the last question I have for you. This one was from my dad. He called me and said, I have a polyp in my ear. Is that bad? So I would say 90% of the time when someone asks, is that bad? They're asking, could this be cancer? That's what everybody is afraid of. Any lump, bump, everyone's afraid of cancer. And rightly so, cancer's scary. They want to know if this is something they should be worried about. So my dad was worried because he knows about colon polyps and that those can be cancerous. So when he was getting his hearing test and the audiologist said you have a polyp in your ear, he was like, oh crap, like, could this be bad? Could this be cancer? Don't worry, Dad. I've never heard of a bump in someone's ear ending up being cancer. So I asked him, is it possible that this bump in your ear was a little bony growth? Because sometimes that happens. And he was like, no, they showed me. I saw it. It was a polyp, and they told me it was a polyp. So the audiologist referred him to ENT, the ear, nose, and throat doctors, and he just went recently. And guess what? It was a bony growth. Booyah, Dad! But I am glad that he went and got it checked out, and so now he can be reassured and not worry about his ear bump. So that's all of the questions I have for you guys today, and believe me, that is by no means all of the questions I've been asked over the last few months, but we'll stop there for today. Thank you guys for watching. This week we got over 600 subscribers, so I'm really excited about that. Please don't forget to like this video and subscribe if you haven't, and I'll see you guys next week.